And I'd like to thank the Farriers Journal for always getting in behind the farrier industry. It's great to have their support, and they're always pushing new information through their magazine, and it's just wonderful that we've got that resource behind us. I'd also like to thank Soundhorse, again, to have a shoe manufacturer behind us, supporting us. It really means a lot to me as a farrier, because I do think that the farrier industry has room to move forward. It's based on a very traditional mindset, shoeing, it kind of came through blacksmithing, but it is great, and certainly more of a manufacturer that has a lot of newer products, they're offering newer ideas, and we're going to run through some of those tonight as well. When I look at, kind of to bring everything into context, when I look at older senior horses, normally I can break it down into two basic groups. And when I am looking for adhesives, or I'm going to use this sort of technology with an older equine, a lot of the time it's hoof quality or pathology. So we can kind of break those down a little bit more. In this webinar, I'm not going to have time to go through everything with these, so I'm just going to pick certain bits and pieces of some of the more common things that I find with these horses. But a lot of the time, circulation within the hoof capsule and breed of the animal is one of the biggest obstacles I'm going to meet. Quite often when we think about the hoof capsule and how it performs, we've got to keep in mind that it's basically a hydraulic mechanism that's pumping the whole time. So as the foot lands, all the blood disperses out of the capsule, and through centrifugal force, it fills the capsule again during locomotion. So sometimes with these older equines, we can have poor foot quality, and with that can actually, the blood supply within a physiological range, we can have not enough circulation, or we can have too much movement of the capsule, and we actually start to, the capsule's not performing as well as it could. So I like this video here from Jeff Thomason, and it just shows you the downward pressure. If we look at the coffin joint would be sitting right in here. And so we're looking at the pressure, the dissipating pressure onto the capsule, and how the capsule responds. And we think about the vascularity within the capsule, so we can appreciate that within a physiological range, not enough expansion and contraction is bad, and too much could also be too bad as well. And that's when we see, when we have too much expansion, we can see the hoof wall and sole start to become compromised. So I do like to think about the horse's foot and the architecture and the way we approach it. When we're using any kind of shoe, it doesn't matter whether it's a more advanced technology or pragmatic kind of shoeing, it's important that we understand how the hoof capsule performs. And I think sometimes as farriers, we replicate work we've seen online in magazines or whatever it will be, but sometimes we've got to strip all that back and think about the function of the capsule itself. What are these parts of the capsule actually doing? We know we've got the lamellar bed that adheres from the parietal surface of the coffin bone and interdigitates with the hoof wall. The solar corium, which is responsible for perfusing sole mass, which is really important. But above all else, we start to think about certainly this from a lateral view, and we think about the hoof wall and the exterior sole is essentially encapsulating that bone and offering protection. So the primary principle behind the hoof wall, of course, is to protect the underlying structures. So I think when we look at using any kind of shoe, we need to think about, is the foot performing well? Is this foot, does it need some expansion? Does it need, do we need to actually gather this foot up some? So we can't be looking at our feet and just assuming that we can apply the same trim to all the feet and then just put a shoe on, a different shoe, and it's going to fix everything. I think that when we are looking to put a different style of shoe on, we also need to be reevaluating the trim, and through reevaluating the function of the capsule, we can reevaluate our trim and then reevaluate our shoeing. So I think we need to be careful as foot care practitioners that we're not relying on a shoe change to fix everything, that we've got 4 or 5 different trims that we have access to, and we can use them on different horses for different foot types as we go, and trying to neutralize some of the hoof capsule's reaction to dissipating force and ground reaction forces. And create more of a robust capsule around that coffin bone. So when we think about a lateral radiograph like this, we look at the hoof wall thickness, but we've also got to look at the dermal layer, the lamellar bed in here, and how much solar corium. Quite often we will measure from the distal end of the coffin bone to the solar surface, not including the cup. We've got to be very careful that we don't measure the cup with sole depth. But actual fact, the solar corium actually takes up quite a lot of room, as does the lamellar bed. And I kind of think about it like when I see poor foot quality, I liken sometimes the wall and sole to like a cardboard structure where when it's dry, it's very, very rigid, but the minute it gets wet, it deforms very, very easily. So, and of course, in this situation, we're also thinking about foot balance. And I think that's where sometimes as foot care providers, we can get into a little bit of trouble where we're trying so much to balance these horses and make these horses biomechanically efficient that we're actually reducing the amount of protection around the bone by removing too much sole mass in an effort to try and get balance. So I think for me, the catchphrase there would be hoof mass trumps hoof balance, but we should always be trying to achieve hoof balance. And when I say that, I think we need to start to set these horses up a little bit more pragmatically, where if we can't balance a horse in one shoeing, we're very transparent with the owner, trainer, whatever it will be, and we offer a more short-term solution, and we set these horses up more artificially so we have got foot mass left. In regards to foot mass and sole depth and hoof wall thickness, just as an indication of how important it is and how the horse responds, quite often we look at the coffin bone, and the coffin bone will tell us a lot about how the horse is managing the dissipating forces, and we see a lot of demineralization of the coffin bone. We see a lot of coffin bone asymmetry. So we've got to be careful when we're even assessing hoof balance, lateral balance via radiograph, where we can quite often have the coffin bone in an asymmetric kind of shape. So we've got to be kind of almost look to picture frame around it. And it's very, very common. I've got a few radiographs here that'll show the amount of change within the coffin bone. And I think when we see osteolysis or demineralization, asymmetric coffin bones, I think it's fair to say that the hoof capsule is not performing as well as it could. So the vibrations caused through locomotion are actually not being dissipated by the time it makes its way to the bone. So if you see asymmetric coffin bones on radiograph, the first thing I would do is I'd take a pair of hoof testers back to that horse and I'd start squeezing on that horse to see how much foot mass I had. Just another bone here, very, very asymmetric bones, heavy demineralization on would be the left-hand side of your screen. So just, I wanted to put that in there because it's important, like, to reiterate that we don't just assume that we can put a different shoe on a horse that's going to fix everything. We've got to change our whole approach. And here's just a little case study of a barefoot horse. We can see that the heels here are really in quite a laid forward position, that kind of underslung. We've got some flaring in the kind of anterior portion of the foot. But after a trim, quite often like I say, I've got 4 or 5 different trims that I'll use depending on the foot type. And I'm not afraid to use a hijacked barefoot trim and barefoot trim the horse and then use adhesives on top of that. The wonderful thing about using this style of trim is when we're shoeing a horse traditionally with nail-on shoes, we need a very sharp edge between the distal end of the hoof capsule to meet the shoe to get that nice crisp finish. As with adhesives, you don't need that. So the wonderful thing about this trim is I have not touched this foot here in the dorsal end section of this foot at all. So I've got maximum thickness still in this portion of the foot. And really, I've just rounded up this outside edge. And what can look really nice with adhesives, if you're directly gluing them on, is you'll get a nice straight line of glue around the adhesion point between the foot and the shoe. And you've got this nice little ring there. So aesthetically, these can look really good when we do start to think about hijacking different trims. And it's almost like a hybrid shoeing where we're crossing over different styles to create the best functional foot that we possibly can. When we are thinking about adhesives and senior foot care, a lot of the time when we're reaching for these products, it's hoof capsule rehabilitation. It may be that we are dealing with bruising. It may be dealing that we're environmental conditions have been such that we've got a high fungal count and the hoof wall quality is just kind of withering away on us. It could be that the sole thickness is just not enough. The corium isn't producing enough sole thickness, and we've got some bruising. And here's just a radiograph here showing very, very minimal sole depth. And to break that down again, what I was saying earlier, we need to break that down. So we've got the solar border of P3, the solar corium and sole border, then the sole surface. So even though it looks like we have a decent amount of sole depth, we have to consider that the dermal layer sitting underneath that bone is actually occupying some of that space. So when we view these horses from the sole, I think we need to be careful with our knives, certainly with older horses. Generally, I'll put my knife away. I'll tidy up the frog to kind of get my landmarks around the foot. That's personally the way I define. I can survey the area if I can get down onto the live apex of the frog, and I can read my collateral groove depths and all that. But I think we need to be careful about what we're actually viewing, although this doesn't look like very much here. 4 weeks later, this comes to the surface. So anything I see from the exterior of the foot, I'm always trying to think about the underlying conditions and what's being affected underneath. So it's fair to say that this horse, we've got this necrotic area there. This horse obviously had some internal bruising. The sole, the dermal sole, the corium is obviously compromised at one point. But so everything I see from the outside is, by the time I see this necrotic area, this is obviously like a month to 2 months old by the time I see it. But regardless, you know, these older horses that are barefoot a lot of the time, I do like using adhesives on them because there's no nail holes. I do think that we need to revisit some of our principles around more traditional shoeing, because every time we drive a nail into the horse's foot, we're doing some element of damage. I always, if I am nailing, I always try to use the smallest nail possible, because I think there's also a certain amount of displacement pressure when the nail goes into the foot, and some horses will handle this well and others won't. But when we use a direct glue on like this, especially with a synthetic material like polyurethane or a urethane shoe, we're basically recreating a very you've got to be careful with emotive words like natural, but we've got independent heel movement. We're not limiting expansion of the foot at all. We can put this on. The protocol around gluing is really important. That it's I know some people think that gluing can be a little bit of a cop-out, but we need to be careful about how we're gluing. Like this foot here, I certainly haven't got glue very far up the foot at all. I've gone around there with gauze and dropped the glue line as much as I possibly can, because I want to have this horse back barefoot as soon as possible. So I don't want glue over the foot. I want to use this shoe as an aid to get this horse over the hump and move forwards. It is possible through shoeing to enhance sole growth. This is one of those life hijacks when we're shoeing horses, that we can influence them, and when we can use horse shoeing in a positive capacity, use it for a short duration amount of time, and get these horses barefoot again. When I'm doing this with horses, if the short-term goal is to get them barefoot, my trim will be always geared towards that. I won't be touching sole mass at all. I'll be rounding up the end of the foot like I explained earlier. In the back of my mind, I'll always be gearing to the fact that this horse needs to be barefoot sooner than later. So when we're enhancing sole growth, there's basically a marriage in the horse's foot between the deep digital flex tendon, the circumflex artery, and the vasculature around the lamella bed. So when we get tension in the deep digital flexor tendon, essentially the coffin bone has to articulate forward and compress. And this is part of the hydraulic circulation within the capsule, so the coffin bone kind of articulates forward and creates tension and compression within the capsule. So when we think about that hydraulic nature, the deep digital flexor tendon creates tension, and therefore we get vascular compression, and that's part of that regulation of blood through the lower limb. So if we were to think about that again and hijack that a little bit, if we were to wedge a horse up and take some tension out of the deep digital flexor tendon and place a rocker toe around about where the apex of the coffin bone would be, we can actually create less tension and compression within the capsule. So this would be one of those areas where I would hijack a barefoot horse, and I would explain to the owner trainer that my intentions, if thin sole was the issue or point of lameness, that we could use this method here over a short duration. Radiographically at the hospital, we've found with this theory or concept that we can double sole mass in 4 weeks. So 4 millimeters of sole would end up 8. So with an 8-week period, you could essentially have a significant amount more sole mass than what you had. So again, if we employ adhesives into the situation, no damage with nails at all, we can get this, we can do it directly or indirect with adhesives, and we can create more sole very, very quickly. When I do wedge a horse, here's an indirect method. This is the cuff. This is the SM Sigafru Series 1. We'll put a heart bar in there. I will always offer sole support in some form if I'm going to use this method of trying to create more sole mass in a very short amount of time. I think it's just one of these hijacks that you kind of need to be all in with. And there's a few different ways. We can also do it with a pour-in orthotic. It can work really, really well. So really, like I say, for a horse that is thin-soled, we need to be thinking about the primary purpose of the sole and the wall, and we need obviously a certain amount of it to protect that coffin bone. Here's just a horse with poor wall quality. All horses, I've never seen a perfect horse with conformation yet. This horse here, obviously very, very fetlock varus, offset in the knees, which ultimately compounds on the feet. And they can be a challenge to work with because the dissipating forces on those feet is uneven. Force typically follows a straight trajectory, so we can almost draw some lines through these feet and figure out where the force is going. So if force follows a straight trajectory in these feet, we're going to have lateral overloading due to the fetlock varus conformation. Not just that, we can also measure this angle, and this becomes a measurable angle where we can grade bone deviations within the limb. Again here, very, very asymmetric coffin bones, more so laterally on the right. And this is all conformation related, but these are all things where if I do see radiographs on a first visit with these horses, which I normally do request, we can start to read into these radiographs and figure out where these feet are overloaded and how they're performing. So here's the right front lateral heel quarter sitting here. We can see that wall quality is being compromised because we've got more compression because the conformation is so severe. The deviations are so severe. We can see that the heel is starting to kind of move its way forward into a more crushed, underslung kind of position. So, you know, very, very difficult. Like nailing through that lateral quadrant would be risky. This is a thoroughbred as well, so we haven't got a lot of wall quality anyway. I think it's important that when we are assessing foot types, that we're taking into consideration how robust they are, how much material they have. If the heel bulbs are displacing very, very evenly under thumb pressure, obviously we need to try and neutralize some of that. So there's different ways we can do that. Here's the radiographs of this horse laterally. We can actually see just a little bit of coffin joint arthritis starting to set up in here as well. So it's fair to say that the vibrations caused through locomotion for this horse are starting to take a toll, and it's appearing as ring bone. So we need intra-articular coffin joint arthritis and a little bit of low ring bone here. So it's fair to say that we need to probably offer this horse a little bit of stability. Here's the lateral quadrant of that foot. We can actually start to see cracking here. This whole kind of necrotic area here, where the foot's basically just overloaded, and Obviously it's not perfusing as well as it could, so the heel structure is well underrun and the tubals are completely changed direction and all shunted forward. So when for this horse here, I put an indirect application on. I didn't want to glue directly on, and interestingly enough, the reason I didn't want to do a direct glue with this horse is this horse struggles to stand for any significant amount of time on one foot, and that's one of the considerations with elderly equine care when we're using adhesives that we need to think about. Using a direct glue on approach, obviously we have to have the horse's foot in the ear for a decent amount of time. As an indirect application with a cuff, we only need it up for 30 seconds. And later on in this presentation, I'll show you how I wrap these feet in a very, very short amount of time, where you're more painful seeing your horses. It's very low stress, and it's very easy on my body to do an indirect application. So for this horse, it was a no-brainer. Again, indirect heart bar, and this horse does particularly well in this. This horse does get ridden occasionally, depending on the lameness, how lame it is. So heart bar, we can get a more positive articulation of the coffin bone and a deformable substrate. Very, very easy to do, a quick modification. Because of the conformation, normally I'll just roll that toe out as well. I'm hesitant to put a rocker toe into these horses until I really know where this horse is breaking over. I don't want to get in her way or direct the flight path too much. I want to offer this horse the ability to unload in whichever direction she wants. So, when we start thinking about pathology, because I think hoof quality kind of leads its way into pathology. If we don't have a capsule that's performing really well, it's highly likely that we're going to end up with arthritis, or there could be some other things. And ultimately, it kind of comes down to, when we're dealing with pathology, is mobility. Can the horse move? Do we need to enhance? We know that movement for horses is essential. And then the comfort level. How comfortable can we make them? Of course, no one wants to see their horse lame, and I think farriers can really positively influence these horses with shoeing mechanics. Certainly for your retired horses, it can be really beneficial. So one of the more talked about pathologies is navicular, even though it's like an emotive hot topic word. We've got to be mindful that not all caudal heel pain is created equal. There's a lot of different things, and we're very, very used to seeing demineralized osteolytic navicular bones like this, where the outer cortex is kind of really kind of sclerotic and just not doing so well. But here's on the right hand side of your screen, here's a case that I worked on this week. This horse is retired and had some navicular change, but if you look at that little fragment of bone, it actually fractured off a piece of navicular bone, or possibly the suspensory ligament of the navicular bone actually took a piece of bone with it. So the retired horse that went lame very, very quickly. I think my point to this slide is that we can't just group lamenesses and assume we can't assume that what we're seeing is a reflection of just common lameness. One thing I will tell you, working at the hospital for 8 years, is be very, very open-minded to what lameness you're dealing with. And we're going to look at that a little bit more as we go. So for this, we can put in a heel plate and just rivet it in. I've just simply riveted this aluminum heel plate in there. The great thing about this is once it's on, the navicular bone is going to be sitting right in there. So we're actually creating, opposing the ground reaction forces in that area and creating more stability in the back half of the foot. Highly likely that, certainly with that bone fragment sitting in there with that navicular horse, we didn't feel the need that it needed to come out. We felt that it would actually reattach over time with a fibrous kind of connection. I talked to Dr. Morrison about that. So really it's trying to keep this horse as comfortable as we can and demobilize or immobilize the back half of the foot as much as we can. In this case, expansion would be a bad thing for this horse. It would find a lot of discomfort. So another way to do it is, if the horse is comfortable enough, you can use a direct glue on for this approach as well, and wedge them up in this case. You could then, if the horse is sensitive across the frog, I'd certainly look to take that porous orthotic out over the frog area and almost float the frog. And I found this in your lower levels of navicular pain for elderly horses. I found this pretty effective. There's essentially just, like I say, wedge them up, fill it with porous orthotic, and then take it out across the frog. It's not uncommon that we can find more than one pathology in one foot, one leg at a time. And with MRI imaging, not that this is an MRI, but we do see that a lot, where we can have 2, 3, or 4 different lamenesses in one leg. And I think as hoof care providers, it's important that we focus on the largest, where the greatest origin of pain is coming from. When we're dealing with multiple origins, this horse here, thin sole, and actually had some rotation as well. So from a mechanical viewpoint, we need to offset the dorsal region of this foot. We can see we've got a little bit of flaring. This is certainly later in the shoeing cycle, but we've got a degree or two of rotation and thin sole. Here's your dermal layer right here. So very low. We're looking at a millimeter or 2 of sole depth. So we need to address this horse from multiple angles. So it's important that we're not one-dimensional in our approach to elderly foot care, because by the end of a horse's life, they can certainly be carrying a lot of pathology, and sometimes it's not always complementary pathology. That sometimes the pathology can actually oppose each other, and you've got to pick which way you want to go. On one hand, a shoeing method or mindset might suit one of those pathologies, but then contradict the other. And sometimes they're complementary pathologies. So we need to think about that. Again, with thin sole and the pull of the deep digital flexor tendon, we need to start thinking about creating some kind of mechanical advantage for these horses. Your thin-soled horses, by the time that bone comes down and compresses on that circumflex artery, we know we're not going to be perfusing that well. So we need to set them up in hyperperfusion. One way around that is actually just putting some roller motion mechanics that are centered around the coffin joint. It's very, very important if we're going to put roller motion mechanics into our adhesive work or elderly horses, that the center of rotation and the belly of our shoe is in alignment. Sometimes I'll actually set them up just a touch behind, and I'll move more into that later, what's and whys, but it's certainly not guesswork. We need to be mapping our feet out really well. If you haven't got radiograph, you need to be able to find the widest point of the sole. Will give you the coffin joint landmark, and then set your trim up around that. So there's a convex surface on the bottom of this horse's foot. This horse is sore. One of the best things I do like about adhesives with elderly horses is the fact that there's no concussion putting these appliances on these horses. With nailing on, sometimes arthritic pain, just the nailing process can make them sore for 2 days afterwards. So another benefit in my mind to adhesives, and why we generally use a lot of them at the hospital. So he's kind of like just breaking this horse's foot up, the widest point of the sole, in alignment with the convexness of the shoe. This horse here, not a lot of foot quality. I want to stabilize everything up. I've also got a shallow pore of a very, very soft pore and orthotic in the sole. And I think when we're dealing with thin-soled horses, that if we do put a pore and orthotic, we need to be matching the density of the sole that's already in there. So your hoof testers, get in there and see how soft everything is. If everything's really soft, put in a soft pore and orthotic on top of it. If you've got a little bit of rigidity in the sole, you could probably put in a firmer pore in. So kind of dotting the I's and crossing the T's. We know we've got a little bit of rotation through the mechanics of it. That's actually like a low-grade club foot as well. So we can take out some of the tension and compression in this foot by putting on a convex roller motion shoe. And you can just see it doesn't always have to be a lot. It's not a case of if a little is good, more is better. You can just see the amount of lift I've got there in the heel, making sure that if there's any thrush around the horse's frog, that is all taken care of before we put these appliances on. Of course, as soon as we put a bar over a frog, we can't treat this that easily. I always treat every foot as its own entity. This foot here, the opposing foot, of course, is pretty much a flat shoe with a rolled toe ground into it. So every foot for itself. There's no rotation in this right front at all. It is, like I mentioned earlier, it is possible to have multiple pathologies in a limb. So in this case, radiographically, well, neutral to negative palmar angle, navicular bone changes, mineralization of the deep digital flexor tendon, coffin joint, and also low ring bone. So this horse here is like 21, limited mobility in the front limbs. When we show them, you can already see here that I've actually already put some mechanics into the limb, but leaving, interestingly, leaving enough sole mass. But if you do look at this radiograph, it's quite interesting. You can actually see the dermal layer dip, the corium, and your lamella bed. So you need to be very, very careful. I think these are the kind of horses, when we see this internal architecture like this, that we accidentally may see a speck of blood because we think we've got a lot more sole depth than what we do. So I think that the take-home message from this slide is just be aware that the internal structures have the ability to kind of change. And that's why when I'm dealing with these horses, my hoof testers are my main go-to. I'm going to be testing how much density of foot have I got left. I'm not, a lot of the time when I'm poking around with my hoof testers, I'm actually just seeing how much foot mass I have, how much resistance I have when I squeeze. So very, very difficult cases. In a case like this with a slightly neutral to negative palmar angle as well, we know that this horse is only going to get more negative as the shoeing goes on. So I would, in a case like this, I would actually start my roller motion mechanics back a little bit from the widest point of the sole, assuming that as this horse grows, it's going to grow through, and it will line up as we go, and I'll explain that more with this slide. We can see that I've actually set my roller motion mechanics behind the widest point. So this is going to transcend through the shoeing and be more complementary during the shoeing process. We've got to remember that when we balance a horse, balance is only a moment in time. The next day, the horse is already starting to grow out of balance. 4 weeks later, the horse is out of balance. So, and then your internal compression and tension within the capsule only gets stronger and stronger. So it's just as important with the senior horses to keep them on a tight shoeing schedule. When I'm putting these kind of the style of shoe on, I'm going to either fill them with a porine orthotic to take up the void between the sole and the shoe, or I may use impression material of a kind. I'm going to medicate that solar region the best I can. Of course, we're not going to have any access to it. So if you kind of look on the screen, you'll see all this finely ground copper sulfate. So this is my final move before I actually put the shoe on, is the impression material is there ready. The cuff is all glued up, ready to go. I've massaged it in, and I'll sprinkle some copper sulfate on and put these shoes on. I'm going to wrap the indirect application is pretty quickly. I'm going to pick up the limb. Like I say, a lot of these senior horses are very, very uncomfortable. They won't stand for a long time, and that's what leads me to glue, because I don't need them in or indirect glue, because I don't need them in the ear that long. And then what I'll do if I'm using impression material is I'm actually just going to put a little hole in the back of my wrapping and allow the extra impression material to spill out under load. We need to make sure we're not creating any pressure necrosis underneath these shoes, in between the shoe and the capsule. So what I've got here is I've done a couple of webinars now for the Farriers Journal. So if you want to know more about direct application or indirect application, jump on the Farriers Journal website. They'll be there. But I just want to show you this because a lot of people do struggle with the indirect application and how to get them on efficiently. So I've just got the short video and I'll talk my way through it. So it's just how to wrap them. Essentially for me, there's 4 different wraps. There's the toe wrap, up over the bulbs of the heel, and I catch the dorsal area of the shoe. That's going to pull the shoe back towards the heel bulbs. And then there's a medial branch wrap. So I'm grabbing the medial branch of the shoe up over the heel bulbs. And then, of course, there has to be a lateral wrap. I'm going to grab the lateral branch and up over the heel bolts. And what I'm doing here is when I do this, I'm orientating the shoe on the foot as I go. So if I notice the shoe moving, just quickly here would be the dorsal wrap, and that's going to shoot the shoe forward for me. So because of the cuff system, you need a way to secure these on the foot as quickly as possible. So the 4 different wraps, the toe wrap, medial branch wrap, and the lateral branch, and then if I bring the wrap up over the top of the foot, it's going to shoot the shoe forward while I'm wrapping it. So when you start wrapping these, you're going to notice the shoe move a little bit, and you're going to have to counter that as you go. So if you think about those 4 wraps when you're doing it, typically I'll put a wrap around the toe first, and then I'll very quickly see which way the shoe's moving, and I'm going to counter it as I go until I've got enough wrap on that horse's foot that I can put it down. So like I say, there is more of that in the other webinars that I've done for the Farriers Journal, so check them out. To move on from that, I work on my own a lot. I don't have a tech, I don't have an apprentice with me at the moment, so I'm very particular about the process for me, because when we're gluing, it's either going really, really well or it's going really, really bad. So there's a certain amount of technique that goes with it, and there's also a certain amount of organization that goes with it. So for me, I've got the horse's leg wrapped. I don't want to be leave glue all over this horse's foot. We're sanded, we're dried, and then I'm going to organize everything I need. I do have a little gluing tray with me. Like I said, I don't want to be scrambling for copper sulfate at the last minute. I want it right there. So if things start unfolding, especially in summer, the glues set up a lot quicker. These methacrylate glues are very ambient temperature. They can be affected by ambient temperature. So just a point that we really need to be, for me, I like being organized, and I like having everything right next to me when I'm gluing. So this is the same horse with the coffin joint demineralization and navicular changes. This horse has a little bit of roller motion mechanics. I've set those mechanics back just behind the coffin joint a little bit. So as this foot grows forward, my mechanics are going to grow into the shoeing. Length of shoe is really important when I'm trying to rehabilitate these feet. I think the distortions that we're seeing in the hoof capsule are, we need to almost forget about what the horse is showing us, and we need to offer the horse the support that a healthy capsule would have. So we almost need to picture frame these feet. If we've got underslung heels, there's no longer any point shoeing to the distorted structure, because the distorted structure is the horse trying to move off the pathology that lays proximal to it. So I'm always going to shoe back and give these horses a little bit of length. These shoes, the cuff system shoes, are very, very difficult to pull off. I think 9 times harder than a nail on when they're applied properly. So I've got a small wedge. I've got my impression material sitting in the back, making sure that I don't have any glue communicating with the hairline. Abscesses, in my opinion, these, for elderly horses, this is certainly one of the most common ones. And I actually think abscesses, subsolar abscesses, are one of the most undertreated conditions for any horse, to be honest. Here's a horse here. We can see that it's just that little kind of necrotic area sitting up there. We've managed to get a little bit of drainage out of it with a little dig. I do think that when we think about where the abscesses lie relative to the internal anatomy, that, you know, we know they lay within the solar corium, or it could be we get a lot of bar cracking or bar abscesses. We know that that's communicating with sensitive structure. Just this slide here to kind of point out how close to the bone structure that actually is. So for me, to pop an abscess and just put it back down on the ground for it to become infected more with bacteria or funguses that we know are prevalent in a lot of situations in horse husbandry, I think it's certainly something we could take a little bit more seriously, just given the close approximation to the bone. It's also very, very common that we get osteomyelitis, or the infection through the solar corium or lamella actually makes its way onto the coffin bone. We do see that fairly regularly, and it's certainly a concern if we see them at this point. Sometimes we'll use sterile maggot therapy, debridement therapy, or we may even use a regional lymph perfusion. And this horse obviously is going to be very, very sore. So nailing on any protection with a horse with an abscess is, it's going to be difficult, and a lot of the time it's, and you can only, sometimes with the nailing process, you're only creating more inflammation anyway. So if it was in the sole region, I certainly wouldn't put a direct glue on, but I would look at using an indirect with a treatment plate. There's no reason that we can't fabricate these shoes to suit our needs. A treatment plate is very, very simple to get on top of these. To kind of revisit conformation a little bit, the conformation is going to of the limb is going to take a huge effect on the arthritic conditions that we're going to see relative to the conformation. Here's a horse, and you'll see this horse turn when I play the short video, and she'll kind of jump just a little bit. But what we're really looking at when this video is the instability of that limb. You can see that just not turning well at all. And we've got carpal varus conformation, and we see the conformation on these older horses really change. Obviously, very, very lame, broodmare. Just that instability. We see the carpus moving. So what we can do is first thing you want to do is assess how severe it is. And you will see the conformation get more severe as they try to offload the limb as they go. But essentially with these horses, we're going to get that displacement laterally with the carpus. We can also, it's fine to see these arthritic changes from the outside, but of course we see this on the inside, and it's just osteoarthritic bone conditions. But I do think, as hoof care providers, we can offer some stability for the limb. We can give these horses a little bit of lateral extension. Got to be careful with the shoeing that we use with these older horses, because quite often the amount of flexion within the limb is limited. This horse here was even particularly difficult to get one of these on, the indirect, but there was no way she was going to stand to get a direct on. There's no way I could nail. So to offer this horse any kind of support at all, it had to be indirect glue on application. You can do that numerous ways as well. You can, if you're good with welding, you can just weld an extra lateral extension, or it could be a medial extension, whatever you need, onto a shoe, and then we can actually just simply screw this is a series 3 cuff from Sound Horse, and they're handy just to have in the back of your truck for situations where you might run across them and be like, I need a glue on, but I usually use this shoe, but I can't use it this time. Well, with this, you can simply just screw them on, these self-tapping metal screws. Laminitis for elderly horses is pretty important. We do know that insulin levels and ACTH scores go up a lot easier and more frequently with horses over 8 years old. So just a basic, very, very quick rundown of laminitis. If we're seeing it, elevated digital pulse, reluctance to move, hoof capsule with elevated temperature, and a slight leaning back appearance will be the first things I look for. And this will be the typical kind of sat back look. This is, when we think about the internal hoof capsule, we know that the deep digital flex tendon is pulling on that lamellar interface, and that interface is essentially, we've got our primary epidermal laminae and our secondary. And if we compare that kind of attachment like Velcro, it can become inflamed, and then we get, a few strands of lamellar bed kind of breaking, and then in chronic cases, we certainly see full displacement. This is one of Paige Poss's pictures from Nat and the Equine. What she's done here is taken a section of foot off a cadaver limb, and we can see the orientation of the lamellar bed is nice and straight. And this is obviously a laminitic here, and we can see just the disorientation within that lamellar bed. And that is essentially, we see a lot more pathology in the front half or anterior position of the foot more than the back. And that is basically just from the deep digital flex tendon opposing this lamellar interface. So when we do get any laminitic attack, it's important that I like to err on the side of caution. I want to restrict movement straight away. If we've got instability in the attachment from the lamellar bed into the wall, I certainly wouldn't want to exasperate that at all. So straight away for me, veterinarian radiographs and blood work. And I just want to quickly dot on the blood work. I've had a few cases recently. My personal opinion is blood work is fundamental to getting these horses back on the road. We need to see whether they're high in glucose. We need to see what their ACTH scores are. So the kind of differentiating the Cushing's PPID cases versus your insulin dysregulation cases. It used to be insulin resistance, but they've kind of changed the terminology to insulin dysregulation. So the high sugar content creates a high insulin, and if you were to put lamellae into a petri dish and cover it in insulin, the lamellar interface would basically just fall apart. So that's why the insulin scores are so important, and we need radiographically we need to see how much displacement we've got, what kind of condition the bone is in. And essentially, immediate action is based around the fact we need a baseline. We need to be able to compare that horse's pain level and internal architecture of that foot. It may be daily, it may be weekly, and also potentially back it up with venograms as well. Cryotherapy intervention is really useful. We can cool these limbs down for 72 hours, and Van Epps and Chris Pollard have done some really good research on showing the amount of the amount of benefit through that cryotherapy can have. And so having ice boots around is really handy. Once we've got all that information together, then we can start looking at shoeing or a foot care plan for these horses. As far as cryotherapy goes, aggressive icing. Van Epps has done different studies on the effectiveness, but it's certainly the more you can do it in the first 72 hours, you can make it certainly a big difference. Just a small case study here. Here's a horse I stumbled across, and we can see essentially someone has tried to help this horse. They've wedged it up a little bit, but the tension in the deep digital flex tendon is essentially pulling the bone through the bottom of the sole. And here's the distal wall here. So we've essentially just got extensive prolapsing. So when we think about it, it's just a computer generation. We get that deep digital flexor tendon pulling that lamellar interface, and that's where a lamellar wedge goes. We also know that that circumflex artery often becomes displaced, and we've actually seen it in venograms where the circumflex artery is actually above the distal border of the coffin bone. So again, we can hijack some of the mechanical benefit of adhesives, and we can wedge these horses up. We know these laminitis are sore. We know we really probably shouldn't be nailing and using concussion on them. So we can, again, wedge them up, get some mechanics in the toe, and create like a sense of homeostasis and less compression and tension within that capsule. We need to be careful when we're wedging horses up, because there is a difference between a horse rotating and a horse sinking. If you've got complete failure of all the lamellar, you'll essentially the whole bone is just going to sink within the capsule. The horses that are rotating and more stable laminitics, you'll be better off using this kind of scenario with them. So that's what I did with this horse. Wedged it up. I think I wedged it up by 5 or 6 degrees, indirect application. Because of the prolapsing in the anterior portion of the foot, I wanted a treatment plate in there, and that way I can put in on top of this whatever medication I want. We could use sterile maggots, or we could use a low percentage iodine. We can see certainly some bleeding in the toe region there. And the beauty about this is we're deflecting ground reaction forces away from this area. With a shoeing system like this, the ground can't interact with where the horse is most painful. You can also do it again with like a indirect with a heart bar, as long as you're putting that foot into some kind of load sharing capacity in the posterior region. When we've got a compromised toe, it would make sense that we load the heel region as much as we can. One thing I do like about these, almost like a hybrid heart bar, is they've got the polyurethane backing on them. And when we put frog pressure on, we need to be careful with how much the horse can tolerate. But I have noticed that with these almost hybrid heart bar inserts, that I don't have to be quite as careful because this surface here will be somewhat deformable. Here's an interesting case of cellulitis. This horse was non-weight bearing. basically just edema in the leg. This is what I tuned up to, support bandage on there. On the other limb, of course, when we've got a horse that's non-weight bearing on one limb, opposing limb laminitis is always going to be a risk, and it's something that needs monitored on the way through. We certainly, I've actually seen numerous horses come through the hospital that have rotated in a hind limb, and it can be isolated. So it's just something we need to have a think about. So very high, this horse cannot put down its heel at all. So we can kind of help this horse. I think in this case, mobility is what we're interested in. And the interesting thing about this horse, it was very much environmentally affected, this horse. The hotter temperatures, the leg would swell worse. If you can see this video, you can see the little puddle on the ground, and the edema was so bad that it was actually just dripping through the skin a lot of the time. So high pain level and very, very difficult to work with. So with essentially you can use this kind of application like a pattern bar shoe. The wonderful thing here is you've got all that sole support that you can put in there. Quite often with pattern bar shoes, the more they can fall through the center of them, as if we offer sole support, we can offset that some. And again, you can just see how much drainage is coming through the back portion of the foot here. Interestingly enough, once we started to work with this horse and actually offer it some mechanical advantage, this is how the horse responded, with a lot better wool quality. And it was so distinct for this horse. At this point, you can see the cellulitis has settled down a little bit as well. We haven't got as much swelling, which is probably helping this horse perfuse better quality. And I think the reason this horse was non-weight bearing is the leg was so swollen that the deep digital flexor network was basically being strangled within the inside of the limb. Here's just her moving with the application of a shoe on. So we actually got this horse moving, and all I did was I just worked on the affected limb only. So this horse did really well. I'm not saying that she was always easy to work on, but there's nothing wrong with the challenge. So, you know, mobility for some of these mares is what we can offer. More comfortable, and obviously having another episode here, and just, this is just something we fought along the way. You can see here, we're obviously having lameness issues. I wedged this horse up even more to try and create a heel first landing for this horse because she was just loading her toe only. So I would fluctuate with how much wedge that I put on this horse as to how this mare was doing. So a few days before I shod this horse, I'd call the barn manager and be like, hey, how's she doing? Let's make a shoe for her, and we'd go from there. Just fluctuating amount of elevation we put on this horse. And mysteriously, one day, out of the blue, I went in to shoe this mare, and we worked through the cellulitis long enough that she actually, this is her with a shoe off. It surprised myself and the barn manager. So at this point, we actually left the shoe off for a few shoeings. So I think that's the great thing with adhesives, though, is that we can use them short term without doing really any damage to the horse's foot at all, which is one of the biggest benefits. And we can use them under a lot of different scenarios. It may be that this pedal osteitis would be another good example of for a thin sole horse where the concussion of nailing on would be contraindicated, and therefore if we can use an adhesive that's not going to do any damage to the foot, it certainly wouldn't do any harm. So I hope you've enjoyed this webinar. I always thoroughly enjoy doing them for the Farriers Journal, and certainly Sound Horse stuff. Really good. So if there's any questions, I'm happy to answer them the best I can, and I hope you've enjoyed it.
Yeah, absolutely. Great job, Stuart. And we have several questions already. Just a couple of notes. We did record this session, so if you came in late, if you missed any of it, or if you need to leave now and you'd like to check out the Q&A, we will publish this tomorrow as a video, and even down the road, if you want to access it, it'll be on the American Farriers Journal website. And also those other fantastic webinars that Stuart has done will we'll link to those on the page for this webinar. So if you want to check those out, and some great tips for using on glue. We do have several questions. We'll jump into these. If you haven't submitted a question yet, there's a couple ways you can do it. There's a Q&A tab, if you certainly want to type it in there, or the chat feature. I'll look it up there and go through these go through as many as possible with Stuart. So let's get into these. Let's look at that recent, probably the most recent slide for this question. How do you transition from the icing stage to the using adhesive stage?
Good question. With a lot of radiographs, to be honest, we're looking, the cryotherapy stage, obviously will be the acute onset. So I'll be monitoring the pain response of that horse, see how it's doing. We also want to make sure that when we're dealing with laminitics, we've got stable laminitics and unstable laminitics. If we've got a stable laminitic, that lamellar interface is somewhat still interdigitated. If we're unstable, we're seeing continued rotation or sinking. So that's a really good question, and it's so case by case. I'd prefer to be using adhesives. If I've got an adhesive on a laminitic, I'm probably not going to have a lot of access to the solar region. So I'd want to probably make sure that this horse is somewhat stable before I put any adhesives onto it.
Okay. And then this probably can relate to some of these cases that you've shown, but a lot of your work is involved with veterinarians, and some of these cases may require that collaboration. So how do you best work with a veterinarian on a case where you want to implement glue?
A lot of these cases, to be honest, when we're looking at rehabilitation, sometimes the hoof quality is an easy one, and that's one of farrier or a Hoof-Care variety could probably just do on their own. It's something we can easily assess and kind of work through with the owner. But if we're dealing with pathology, I think that's really, if I'm dealing with a high pain response from the horse, that's when I really need guidance from a veterinarian. And that was kind of like my point with a few of the slides: dual pathology, multiple pathology. Are these multiple pathologies complementary, or are they contraindicated, opposed to each other? And quite often we need the whole picture before we can come up with a really thorough shoeing plan. So if you think it's just the horse is thin-soled, thin-walled, I would probably go ahead and put an adhesive on that. If I thought there was more underlying pathology, I'd be getting in there with my hoof testers. If I was getting any reaction around the apex of the coffin bone, or whether I was getting reaction across the frog or around the heel region, I think I'd like to know more about those cases before I went and did anything, regardless whether it was more traditional work or more progressive work. So that is a little bit of experience, but a lot of the time, if I'm getting called in to do adhesive work on a high lameness level, there's going to be diagnostic imaging there anyway. Okay,
get a couple of questions on the application. Wrapping a rear foot, what advice do you have for doing that if you're a first-time glue user?
Excellent question. It's what I will do is, and I think I've demonstrated it in previous webinars, is the wrapping technique's really, really important. And for each side of the horse, you're going to use a different hand. So you need to become a little bit ambidextrous. So with the wrapping technique, you can do a dry run and practice that wrapping without actually using the adhesive at all. And that's what I did in the early days. Was I would just walk up to a horse and just wrap its foot in plastic and getting my kind of how I do it down. So my suggestion there with a hind foot would be to do that. Get the plastic wrap, go to the horse and dry wrap it a couple of times before I use the adhesive. Typically, if I'm on the right-hand side of the horse, I'm going to use my left hand to wrap. And if I'm on the left side of the horse, I'm going to use my right hand to wrap them. So it's all about getting your body positioned in the right spot.
Okay. And again, if anybody would like to submit a question, feel free to do so in either the chat field or the Q&A field. This one, and this can tie back to those earlier webinars that Stuart has done on using adhesives, but where do you typically see a failure of using glue?
The person attaching it to the horse. um, Again, I'll reference the earlier webinars, because I go through in detail in those webinars of exactly how I do this. The preparation is there's just no room for error there at all. You need a buffer, you need to be sanding, you need a propane torch, you need to be drying, you need to be medicating these feet. You need to be picking your shoe selection in relation to foot type. It's important that we don't go to adhesives and just use one strain of shoe, because I think the different foot types are going to need different shoes. If I saw a compromised sole, like that horse I showed with an abscess on the solar border, directly gluing on top of that would be contraindicated. Because I'm going to cover it with glue. The last thing I want to do is cover an area like that that I haven't got access to with glue. So we need to be very, very careful about that. So user error is the biggest thing. And if you haven't had a lot of experience with glue, I just suggest you get with someone that has, and maybe they can run you through how they see it. And then once you've become comfortable with that, ride with someone else, and then someone else, and then someone else. I'm still learning every day.
This one, I'm gonna say this was probably case dependent, but in terms of using glue and maybe the first time with a horse, first time for an owner, do you give them any instructions on aftercare?
The only really aftercare with adhesives for me is keep oil-based products away. I've found that any oil-based products can get underneath the glue and kind of get them off. They'll kind of work away at the adhesive bond. In saying that, with adhesives, I also shoe a lot of horses for rehabilitation centres and that things away from the hospital setting. I've got horses doing saltwater spas, swimming in adhesive shoes with no problems at all. So the application of these shoes is really, really important. But after that, really, they are quite low maintenance. In fact, I'd nearly guarantee a glue-on staying on over a nail-on.
Okay. And going back to an earlier slide, what is the easiest way to put the roller motion modification into a sound horse shoe?
Good question. It's really however you find it most easy. Sometimes what I'll do is actually just I'll take my tongs and put it on the toe and just kind of hold my hand up and hammer them back into it. I know some people have like a jig that they'll use to get them in. It has to be relative. How much mechanics is very much relative to how much vertical depth of foot you have. So if I'm looking to put in roller motion mechanics into a shoe, I'll essentially, as soon as I start trimming that horse, I'm looking at putting those mechanics into my trim straight away. Quite often it's easy to trim everything flat and then realize you need mechanics, and then you're sort of getting into heading towards the more dermal layers of foot, and the whole, you don't get as much mechanics as you should or could. So yeah, if I'm putting mechanics in, I need a way to assess that vertical depth of foot to do that, to do it well. And from there, it's really hammer and tongs and just try to make sure that your roller motion mechanics line up with your trim.
Okay. And with glue-ons, what are your thoughts on resets, and what's maybe a typical cycle for you?
I don't reset glue-on work at all. I do know some people that do reset some direct glue. The cuff system is you just can't reset them. But still, in saying that, I would be expecting between 4 and 6 weeks out of any glue work.
And then I guess this is kind of the other side of the business of glue-ons, the cost. And how do you convey the value of glue-on when a client may be more used to a typical price, but building the cost of glue into your pricing?
I think it's important that the amount of education that goes into doing the glue-on process is important. And letting the client know that you're educated about it. And personally, when I got into doing adhesives before working at the hospital, I practiced on my own horses. I had my routine down. I was looking efficient in front of the client. And I think that transcends well to the client when you look efficient and you can get it done and you're not kind of stumbling your way through it. And I think that's that professional image that we need to portray to these clients. And we need to be practiced. We don't really want to be doing our first horse on a client's horse, or be transparent about it and say to the client, this is my first time. I'm going to give you a cut rate this time and we'll figure this out together. I've heard that works well for people. But essentially, we need to be making sure that we are still running a business and that our costs are covered. The materials alone are going to cost you significantly more, and that's quite often one of the easiest ways to justify it.
Okay. Would you have any concerns about using adhesives with a 700 kilogram horse, or let me rephrase that, also the 1,500 pound horse?
I should have put it in the case study. I actually glued 4 shoes on a Belgian draft. And it was kind of hilarious. I handmade some aluminum shoes. I think there were 17 inches of aluminum went into each shoe, and I used 20 ounces of Equinox and I think 8 tubes to pour in orthotic. So no, the weight of a horse doesn't concern me at all.
All right. Okay, and then for our final question tonight, how thin can you make the hoof wall before you start worrying about the thermal effect of adhesives?
Really good question. And we see this issue somewhat when we're dealing with foal work, stepping away from senior right now. So wall thickness is certainly something we need to think about, and how the heating process of the glue is working. Sometimes what I'll use is a fast set glue, and hoping that I get a faster temperature peak with that glue. In the warmer climates, and certainly during summer, you can put your fast set adhesives into ice. And what that'll do is that'll delay the thermo reaction enough that you can get your work done, but then the temperature will spike very, very quickly. So we're looking at that quick spike instead of a long drawn out. So working on foals can be difficult for that reason. And we need to be careful, and quite often I'll mention it to the client what we're expecting. I'm certainly going to put myself in a position that I'm safe if I'm looking at that thermal reaction. Typically, most adult horses deal with that thermal reaction quite well. I don't really get a huge reaction from the elderly horse population. It's more the young population that I have that with.